Okay, so we're doing part 2 of chapter 10 in pharmacology, talking about retroviruses. I went over my whiteboard drawing of the HIV virus infecting a cell, and now in part 2 we just want to finish up the slides, so this should be pretty quick. Again, here's a picture of what a retrovirus looks like, particularly HIV virus. And as you can recall from the last video, retroviruses always use RNA as its genetic code or genetic material, allow high efficiency of cellular infection. So it takes a small amount of the virus to infect a cell or cells. And human immune deficiency virus is HIV, which is an example of a retrovirus. HIV/AIDS attack the immune system. Most severe form of immune deficiency disease caused by HIV infection is acquired immune deficiency syndrome. And before I go on, just to explain that, HIV is the virus that causes AIDS. AIDS is measured by how many CD4 helper T cells, CD4 and helper T cells are the same. And your immune system is based on how many of these T cells or helper T cells that you have in your body. And because HIV infection takes over the cell, kills the cell, and infect and kill other cells, those numbers begin to drop in your body. I don't know the exact number, but hypothetically, let's say you have 10,000 CD4 helper T cells, which is what you normally should have. Now, in an HIV infected person, that number will consistently drop until they get maybe below 200. And at the point of where you drop below 200, you would be considered to have the acquired immune deficiency syndrome, which is AIDS. Okay? Everyone with AIDS has HIV infection, but not everyone with HIV has AIDS. And again, the reason simply is HIV is the virus that kills all the helper T cells. And once the helper T cells get to a point where they're so low, you now have AIDS. Okay? And noteworthy, when you have HIV and AIDS, particularly AIDS, you are more prone to opportunistic infections. And we discussed this in class. Opportunistic infections basically are infections that you are susceptible to because you are in a weakened immune state. Okay. Here are your 6 classes of antiretroviral drugs. We have discussed this in the previous part 1 lecture. Some of them we haven't discussed. Nucleoside analog reverse transcriptase inhibitors would be one drug class. Non-nucleoside analog reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, entry inhibitors, integrase inhibitors, and they are self-explanatory. If we know the function of reverse transcriptase and we understand that inhibitors block the action, block the action of reverse transcriptase, we know how the drug works. Same with analog reverse transcriptase inhibitors, same with protease inhibitors, fusion inhibitors, entry inhibitors, integrase inhibitors. It's all the same. Your job is to know the action of the drug class, understand the side effects, adverse effects, understand what the differences are between the drugs, and understand what the similarities are. Okay. So these drugs are virostatic, and they're given in cocktails. What they mean by cocktails is that maybe you want a reverse transcriptase inhibitor and an entry inhibitor, or a fusion inhibitor and a protease inhibitor. They try to knock HIV out in like a 1, 2, 3 punch, and they do this with those meds. Um, Patients are given highly active retroviral therapy. Drug resistance is common, but it is related to the missed drug doses. Again, patient teaching is very important, letting them understand that missing medication can make their current virus more resistant. Be alert for allergic reactions. Be alert for drug and food interactions. And of course, the intended response is the suppression of viral reproduction, and is measured by the viral load that we were just discussing and decreased opportunistic infections. How antiretroviral drugs work. I've already went over this with you. You can take your time and look at this illustration if it helps. NRTIs inhibit reverse transcriptase and viral DNA synthesis, slowing viral reproduction. Side effects: nausea, headache, GI upset with fatty food or fried food. Adverse effects: know your toxicities. Liver toxicity is very big in antiretrovirals. Um, Make sure you know your toxicities in all of the drug classes throughout this book. Patient teaching: avoid fatty foods and fried foods. Inform your patients that they may experience loss of sensation and they would need to stop an RTI such as abacavir if flu-like symptoms develop. Again, we don't worry about pediatric or pregnancy considerations. However, we do for adults, and they have peripheral neuropathy, and they would need to prevent injury. Peripheral neuropathy is something that we typically see in diabetic patients where they have nerve damage and it decreases their sensation in their lower extremities or distal extremities. And NRTIs disrupt HIV replication or reproduction. Side effects: nausea, rash, headache, abdominal pain, difficulty sleeping, vivid dreams or nightmares. Adverse effects: anemia, liver toxicity. Patient teaching, you can read that, and so on, and so on. Noteworthy for protease inhibitors or PIs is that you will have abdominal weight gain. It is liver toxic. You will have uncontrolled bleeding in patients with hemophilia. Darunavir and fosamaprevir, gosh, I know I'm not pronouncing those correctly, both contain sulfa, and that is important because many people do have sulfa allergies. For your patient teaching, you want to encourage them not to crush or chew capsules. Check pulse twice daily for a full minute. That will be an apical pulse, and do not take St. John's wort. Older adults, fusion inhibitors, you can read this. Same for older adults. Entry inhibitors. See how some of the drug classes have similar patient teaching, similar adverse effects. For instance, this particularly has hypotension, but all of them have liver toxicity. And this is true for most of them as well. Do not crush or chew capsules. And because of the side effects of hypotension, you would want to instruct older adults that they may have possibility for having orthostatic hypotension, and make sure that to prevent them from passing out behind the wheel, they would need to understand how the drug works in order for them to make decisions on where or whether they should drive or not. integrase inhibitors. Um, Raltegravir, you will see this in the hospital, nursing home, clinic setting. This is a very common, popular HIV medication. It inhibits the enzyme integrase. Side effects is primary diarrhea, adverse effects anemia, hyperglycemia, and rhabdomyolysis. Okay, rhabdo. Sorry, I lost my slide. Okay. So with rhabdo, basically, it means that the patient has some muscle damage, and in having muscle damage, the proteins break, cleave or break down from the damage, tries to pass through the kidneys, causes damage, and the patient then will have pink tinge or punch colored urine. Okay. Patient teaching: do not crush or chew tablets. Take with food to decrease GI side effects. Report muscle pain and weakness because of the rhabdo or rhabdomyolysis. We call it rhabdo for short, to the prescriber, and report symptoms of anemia because, again, the patient may be losing blood because of the muscle damage that they are experiencing from the medication. For older adults, they are more likely to take statin type of lipid lowering drugs. So just be mindful of that. And this concludes the remaining portion of chapter 10 in pharmacology.